You're watching the Randy and Christa show. I'm Christa Orecchio.
And I'm Randy Alvarez.
And this is news that makes you healthier. And we are bringing back a beloved guest, Dr. Terry Wahls, who is a professor, a medical doctor and a professor at the University of Iowa, making huge strides on MS research, helping people, rendering them virtually symptom-free. And today, Randy, we're going to bring her on to talk about what other, since she's launched her book, the last time she was on the show, what other conditions are improving based upon her protocol.
Now, you've read her book, you know the Wahls protocol. So she's saying, I just want to clear, that people, that I guess she got rid of her MS, or reversed it, right?
Stopped it. You don't get rid of it, but you stop the progression.
But she no longer has a progression of MS. But now she's made the connection that not only is the MS going away, a lot of other things are going away. Is that right?
Here's the thing, is that the body is a systemic organism. You can't address the brain and not address the blood and not address the digestive system. And so when you start making positive dietary changes, and her whole thing started to eat for your mitochondria. So the mitochondria is the powerhouse of the cell. In 8th grade biology, we all learn about ATP and energy. And if we have good ATP and our mitochondria are healthy, then we have energy, we are healthy, the brain functions, the heart functions better, everything functions better. So Dr. Wahls teaches you how to eat for your mitochondria, and just by her doing that, and she's going to talk about it, she went from living in a tote recline wheelchair with horrible debilitating symptoms to 6 months later being able to bike 18 miles. That's the power of food as medicine when you learn how to eat for what's going on with your system.
So in your own clinical practice, have you seen people that came in for one thing, and just because of the diet and the testing you're doing and the targeted nutrition, that their symptoms are also going away? That means they came in for one thing and everything else gets better?
Absolutely, yes. It's so exciting because you can't just address one thing. A lot of times they don't even know. They come to me, they have one autoimmune disease, lupus. They don't know that they also have another autoimmune disease, Hashimoto's. Because we're going to talk with Terry. One autoimmune disease, now the body's confused, it begets another autoimmune disease. And so you want to reverse the entire terrain, and then everything starts reversing, and that's when people get their lives back. We've got lots of people who join our 3-month program online, and they say, and Terry's going to speak to this, they say, when I follow and I eat according to the diet, I have no symptoms of MS. But it's a slippery slope, because when you're dealing with something like a neurological disorder, you cannot cheat. And when you cheat, the symptoms come back. And so people come for different reasons. I had a client come, she just wanted to lose weight. That was her sole focus. She didn't tell me she's in debilitating pain all day long because she had rheumatoid arthritis. And so we start to do some cleansing. This is a world we live in. We have to cleanse. About 2.3 pounds a day we should be getting rid of toxins. So we start to cleanse her. She's losing weight, yay, getting to her goals. But then all of a sudden she's amazed because she hasn't experienced life without pain for 2 decades.
Wow. So, I mean, you're big. I mean, you look, on local news here, you do segments. What is it? Food as medicine?
Food is medicine.
Food is medicine. So now we have a medical doctor who is a researcher that is kind of going back to what you've been doing all along, right? Which is nutrition.
It's the whole
Is that what's happening out there right now?
point and purpose of this show is to build the bridge between medical doctors and naturopathic doctors and nutritionists. And if we can all join forces and use our skills for good, we can then translate personal accountability and responsibility onto the patient or client, that they have the power to heal. I think that's the most important message.
Okay, great. Let's go to let's bring her on the show.
Sounds good. You're watching the Randy and Christa show. I'm Christa Orecchio.
And I'm Randy Alvarez.
And this is news that makes you healthier. And today we're back with Terry Wahls, Dr. Terry Wahls, MD, who wrote a book called The Wahls Protocol. And she's been on the show before, helping people reverse symptoms of MS and neurological disorder. And we're very happy to have her back with us. Dr. Wahls, welcome back.
Very glad to be here. Thank you for inviting me.
Let's talk about what happened, Dr. Wahls, since your book came out. What are the results that are happening? You just did another round of publishing. You're really kind of covering all autoimmune now, right?
Correct. So there are several things that we've observed. I have a clinic now called the Therapeutic Lifestyle Clinic. And in this clinic, we see people with a wide variety of health problems, medical, neurological, psychological. And we're using basically the Wahls protocol diet and Wahls protocol concepts for these folks. And I'm seeing weight fall off, blood pressure normalize, blood sugars normalize. We need to reduce and often eliminate medication after medication. We see many people with autoimmune conditions, often with 2 or more autoimmune conditions. Again, by adapting our dietary strategies, we see pain diminish, energy improve, thinking ability improve, and the need for medication steadily decline. We've had people with inflammatory bowel disease have things stabilize, and they're able to thrive without any disease-modifying drugs. So that's very gratifying. And we've had some more favorable clinical trials that we've been reporting on. We'll have a paper that should be coming out in the next few weeks.
That's pretty powerful work. And so when you're saying the Wahls protocol, what are the 5 points of the diet? If you can cover eating for your mitochondria in a snapshot.
So first thing you want to do is remove foods that are likely to rev up the inflammation. So that's gluten-containing grains, wheat, rye, barley, casein, which is dairy protein, and for many people, eggs are also a problem. We have them ramp up their vegetables in the leafy greens, the sulfur-rich vegetables, deeply colored vegetables like beets, carrots, berries, sufficient protein, 6 to 12 ounces of meat. It's not a high-protein diet. We mostly stress lots of vegetables and sufficient protein. And then I talk about stress-reducing practice and increasing movement for the body.
Sounds like a very thorough plan with lots of amazing results, truly changing lives.
Yes,
so when
absolutely.
It's so inspiring when you say most people today, one autoimmune disease begets another autoimmune disease. It's this whole cascade. And so you're seeing people with chronic several autoimmune diseases start to reverse, antibodies lowering?
Absolutely. And the kinds of conditions that we've had great success with include things like lupus, rheumatoid arthritis, psoriasis, inflammatory bowel disease, Crohn's disease, ulcerative colitis, fibromyalgia. And then in the neurologic world, things like MS, of course, Parkinson's, early cognitive decline. It speeds recovery from post-traumatic stress disorder, recovery from mild to moderate traumatic brain injury. I mean, when you feed the cells and the mitochondria what they need, they can begin repairing you molecule by correctly made molecule.
It's the fastest way to rebuild your health, cell by cell.
Absolutely.
I have a question for you. In your book, there is, in some of the meal plans, there's soy milk and things like that. And soy, I know, is very controversial in the nutrition industry. So I'm just curious as to what your take is on that.
Why we had that. So what I did very intentionally was I made the first level of the diet as accessible as possible. So in fact, I allow people to have a grain or a legume, 1 serving a day. We'll allow them to have organic soy. And I explain why they probably want to go from the first level eventually to the second level where the soy has been dropped out. This was an intentional decision to make the first level diet more accessible to more people. And the other thing that I did in the first level is I created a structure for those who want to follow a vegetarian or vegan diet for their spiritual beliefs. Although I explain why I think animal protein is a more healthful option, I recognize that for some people, spirituality would now allow them to consume animal products.
I appreciate that, and I do the same thing in my practice where you just want to help people wherever they are and whatever their beliefs are. So what's next for you in the Wahls protocol, and how fast is this spreading into mainstream medicine for MS?
Well, actually some wonderful things are happening. This last summer, the MS Society decided to have a wellness meeting and invited me. I was part of that. And while they were having their meeting, they were reviewing the programming and research priorities for diet and lifestyle. And during that meeting, they had their media person come up and explain that the MS Society monitors the cyber chatter, and they've noticed a big uptick in the talk about diet and lifestyle, then 8 times to talk about disease-modifying drugs. And diet was the number one topic. And the number one topic overall for the year was the Wahls protocol and the Wahls paleo diet, which I think is part of why they got inspired that they needed to re-examine their research and programming priority around diet and lifestyle. So it's very exciting to see.
So Dr. Wahls, Randy Alvarez here. I know you can't see us, but I've been listening and I'm a fan of yours. But with this Wahls protocol, for people that aren't that familiar with you, what's a quick definition or of what it is? What is the Wahls protocol?
So it's a diet aimed at feeding your cells what they need, a lifestyle change to help you reduce your toxic burden and reduce and normalize your stress hormones. It's really an entire way of thinking about how you eat and live your life.
So, Doctor, I know you had MS, right?
Absolutely.
Is that right? Okay, so you reversed or at least stopped your MS. Is that correct?
So I still have lesions in my spinal cord.
Okay.
But I can now jog, I can lift weights, I can hike with my family, I can bike 2 to 3 hours at a time.
So it's not progressing, is that correct?
It's certainly not progressing, and
Okay.
my function is dramatically better and continues to improve every year.
So tell me this. So you're researching trying to cure your MS. You stumble onto
Yes.
this diet. I'm not putting words in your mouth here, but then you realize that by eating this way and eliminating some of these foods that cause problems, inflammation, that it not only works for MS, but it works for arthritis, colitis, Parkinson's.
Yes.
Is that right?
Yeah, absolutely. It is correct. In our therapeutic lifestyle clinic, we'll take anyone with any kind of mental health, neurological, or medical problem who wants to use diet and lifestyle to treat their disease. And we may personalize the program for them, but it's the same overarching concept. And we, time and time again, I see improved function, improved quality of life, reduced shortening medication lists across many disease states.
What do your colleagues and what kind of the medical specialty that takes care of MS, and what do they say about what you're doing? Are they skeptical?
Back in 2008, when I first started doing this, people were very skeptical. But then they saw our research, because every year we have research day for internal medicine and for the College of Medicine. And now that we show our data and we show these videos of people, how they were walking before and after 12 months of our program, and the dramatic improvements that we're able to achieve in many of our people. So the chief of the MS section in our neurology department here, and I've met with him, I've gone over our research data, shown him our videos. He's remarkably impressed, wants to partner with me in any future studies and help us recruit. So he's very enthusiastic. With my therapeutic lifestyle clinic, we invite clinicians to come in, watch our sessions, and see what we're doing. And so we have more and more people coming by, both in primary care and in specialty areas. The pain clinic has come by several times, and they've shifted their practice now after having gone through working with us. So I think because we're so successful with some of the most difficult, challenging people, that's creating more and more interest and more respect.
Now, you mentioned cognitive decline, that this helps with that. That means people, maybe Alzheimer's runs in their family, or they have a little bit of dementia. Yes. They are going to you. And what are some of your success stories there?
Well, what we find very commonly, people come in with problems with memory, with focus, with attention, with irritability, drop in social skills. And this can be from traumatic brain injury, severe PTSD, or early dementia. We treat them with a nutrient-dense diet that's low glycemic, so lower carb. I give them some targeted vitamins and supplements, vitamin D, and we see them back. And often within the first month, people are coming back reporting that they and their family can see noticeable changes in that individual's mood, in their irritability level, and in their attention and focus level.
So are you convinced that this would be like with your MS, they're not going to get any worse with these people with cognitive decline?
They'll continue. They will not get worse. They will likely
Wow.
slowly improve. And then the other thing that we have to caution people is, because we're all human, after 3 to 6 months, they're feeling great. Things are doing so well. And now they're at their nephew's wedding and decide, well, I'm going to have some wedding cake and some pie because it's a celebratory day. And then they'll have marked worsening of symptoms. So it takes a while for people to realize that this is a commitment for a lifestyle change that goes on as long as you want to have the success. That when you have cheat days, you're likely to have a serious decline.
Great. You know, we are out of time. And Christa, why don't you close it? Is there anything we haven't asked her? We have like 30 seconds left.
Well, I just want to commend you for your work and for really building the bridge for functional medicine and allopathic medicine and the idea of using food as your medicine. And it's amazing the work that you're doing. And I just asked, do you have any closing thoughts for our viewers?
In about 20 seconds.
Food is critical. It's not the supplements that cured me. It was the food that restored my health and vitality. That is the most important aspect of the choices you make.
Thank you, Dr. Wall.
Totally agree.
It was a pleasure having you back on the show. And for now, I wish you good health. Interesting stuff. I mean, this is good stuff.
Fantastic. You cannot argue with the results. I mean, she's running clinical trials. This book started out for progressive neurological disease, MS and Parkinson's, and now it's spinning out into rheumatoid arthritis and lupus and colitis and even simple things like brain fog. And it's so inspiring to see the merge of Western medicine and the natural way of using food as your medicine.
So you've been doing this for how long now?
A decade.
So what she's doing, you've got a medical doctor, I guess medical doctors across the country now are starting to treat things with nutrition. I have a guy that's coming on the show. He calls himself a functional cardiologist, an integrative cardiologist. So now, instead of just treating people with stents, and he still does a few surgeries, he says he treats them with nutrition. And here we are, with a cardiologist, and they actually want these drugs, these cholesterol-lowering drugs. And he's saying, I am giving you drugs. Food is a drug. So
it's inspiring.
I mean, do you think this is just going to take over? I mean, do you think it'll take 10 more years where medical doctors are going to say, we have to address nutrition?
I think it may be maximum 5 years, but it's turning over so quickly. Like, for example, I mean, cholesterol is one of the most important molecules in the human body, and we absolutely need it. And so when you have a cardiologist that is just treating the lab work of your cholesterol's high, take a statin to lower it, that is proven. It's leading women towards Alzheimer's and everything that we were talking about because the brain needs cholesterol. So your functional doctor is going to understand, hey, bad cholesterol is high because inflammation is present somewhere in the body. So you don't blame cholesterol. It's like blaming the firefighter for starting the fire. It's letting you know, and it's there to help you find the underlying root cause, and you can't argue with the results. You use food as medicine, and we can all start getting on the train here. We need Western interventions. I'm not against them at all. It's about the marriage of both.
Now, soy.
Yeah.
I know you don't like soy. A lot of people don't like soy. I don't like soy. I'm convinced it's not good for you. She said she deliberately put soy in there so the diet wasn't impossible, and I'm paraphrasing her, but impossible to follow. Do you think that, so if you were, I mean, what's your response to that? Do you think that, hey, just get rid of the soy?
I wouldn't put soy in my book, and I'm sure she won't in her reprint, but I do understand that if this is going out to the mainstream people who are still doing, the pasteurized skim milk, that soy milk is like a huge jump for them, and it's hard to find the other milk alternatives. I understand where she's coming from, but I think that coconut milk, hemp milk, cashew milk, almond milk, they're all becoming widely available.
Well, look, the people that saw her interview, talk to them right now. I mean, you're talking to me, but so why, give me your quick case, and we have a couple of minutes left. Why not soy?
One serving of soy that's not fermented, so it's the process of fermenting out the toxins, can lower thyroid function by up to 7%. And it's proven to imbalance the sex hormones, and it causes, it's also one of the 5 most common food sensitivities, so it's going to cause digestive upset. And let food be thy medicine by Hippocrates 3,000 years ago, he also said all disease begins in the gut. So you can't focus on one thing without focusing on everything.
So a soy substitute for these people that love soy milk, you say coconut milk, what else?
Yeah, no more soy lattes, you guys. So unsweetened coconut milk, unsweetened almond milk. I'm a big fan of organic grass-fed raw milk. Or there's cashew milk, there's hemp milk. What's your favorite?
I like coconut milk.
Okay.
I do that. And some of these other milk. What's the other one? There's coconut milk, and then there's what is the other? The almond milk. So I like that, as long as it doesn't have that carrageenan or whatever.
Carrageenan, yeah.
That's so bad. But with soy, what are these? But women will tell me, and I don't really have the right answer. They say, but soy is good for me. So where did this information come from that soy is good for them? Because you hear that. That's why they're doing it.
Right, right. So it comes from the way that it's processed. In the States, it's processed completely
differently. But why do they
differently.
think it's good for you?
Because if you just study the soy without looking at the quality, it has phytonutrients, plant-based nutrients that can be antioxidant, that can be supportive. But the idea is the way that it's produced, the benefits don't outweigh the risks, and you're going to do more harm than good. It's highly acid forming. A lot of times we're thinking about osteoporosis. The acid-alkaline balance is really important. And so there's so much for the case against non-fermented soy. And what really gets me, Randy, is kids on soy formula. That's the equivalent of feeding them birth control pills. And I have had moms come to me, my little boy, he needs a bra. What happened? And did you give him soy formula? Or is he drinking soy milk on a daily basis? People come to me that, I made the healthier choice, I switched to soy. We run their hormone panel, and it's a mess, and their thyroid needs to literally be rebuilt because you're going to block the conversion.
And thyroid's your metabolic hormone, so if you want to get fat, soy is a good idea. Is that right?
We need iodine, in every cell of the body, and non-fermented soy blocks the uptake of iodine. And so just like one autoimmune disease begets another, one mineral deficiency begets many more. And so you start this negative cascade.
Now you're an expert on this topic, the Wahls protocol. So you think she's on the money across the board? Other than that little soy glitch?
Oh, yeah. I think she is on a mission, a very heart-centered mission, and she's making progress very fast, and we need more medical doctors. We need the research. That's to build the bridge, we need the clinical trials, we need the peer-reviewed studies, we need all of that with the food and the nutrients, and hopefully we can get all these different supplements really registered and have trials on those supplements, because there's such a debate. There was a recent debate in the news about quality of supplements.
And so because this woman obviously can't do a double-blind study with food, right? So she has a bit of a challenge on her hands in the medical community to the real naysayers?
Do you think it's a challenge? I mean, couldn't you do a study with the standard American diet and then making like the 6 upgrades that she makes and run that with a group of people? Yeah.
So I mean, so the medical doctors, because she's hot right now. I mean, she's lecturing to medical doctors all over the place.
Yeah, and what she said was that it wasn't the supplements so much that got her out of the wheelchair, but it was the food. And so, I mean, isn't the proof in the pudding? If someone's eating, here's the way I used to eat, here's the way I'm eating now, and you're taking their blood work and you're making those markers of change, it's obvious that it's
now let me ask you a
providing
question about these soy things. One more time, I want to bring up this soy. So if somebody really wants to get healthy and they just love their soy, have you ever had a problem switching people off of soy?
No.
So it's easy once they know?
Of course. What makes it hard is not giving someone something to go to. Whenever you take anything away from any of us, we're human, Terry said it, in life, you have to replace it with something else. So you replace it with something else that tastes just as good, is just as easy, just as convenient, mixes in your coffee just as well, and then it's not a sacrifice, but yet your whole body is much healthier as a result of that one choice.
It's very nice. One of the things, my takeaways from this Dr. Wall, is the diseases associated with aging, like arthritis, dementia, colitis. or bowel problems, that eating this way gets rid of those problems.
Absolutely. You know, we interview so many people on the show about different fields, but it all comes back to the same thing: give the body what it needs, take away what it doesn't, and it will heal itself. That's the takeaway today. You guys, thank you for being with us. You're watching the Randy and Christa show, and we will see you next time.